Did you know that cost is one of the main obstacles people face in taking their medicines as prescribed? Taking prescription medications can be costly, but if you have Medicare, there is an insurance plan called Medicare Part D that can help you pay for your medicines. Hi, I'm Cristina, a registered nurse with a background in care management, and I'm here to help you with your Medicare questions. So let's check it out. Medicare Part D is optional prescription drug coverage that is available to Medicare beneficiaries. In 2023, there are over 59 million Medicare beneficiaries enrolled in a Part D plan. Although it is regulated by Medicare, it's actually administered by private insurance carriers. So you would purchase your plan directly through a private insurance carrier. There are over 40 insurance carriers that offer Medicare Part D plans in 2023. If you need help reviewing plans from multiple insurance carriers, you can call our trusted partners at Apollo Insurance Group to speak with a representative and ask questions. You'll find their website in the comment section below. You'll have two main types of plans to choose from, depending on how you receive your other Medicare benefits. If you have Original Medicare, which is Medicare Part A and Part B, you can elect a standalone Part D plan, also known as Medicare Prescription Drug Plan, or PDP. If you have a Medicare Advantage plan, or Part C, then you can elect an MA plan that includes prescription drug coverage. Now, you're probably interested in knowing how much these plans cost, and that's a great question. Your costs are largely going to depend on these key factors: which plan you choose, what coverage phase you're in during the year, what tier the medication is in, how many medications you take, and how often you take them. As you can see, that's a lot of variables. The good news is, I can offer some insights into average costs. But before we do that, let's briefly touch on the general cost terms that are associated with insurance coverage, which are monthly premiums, annual deductibles, and cost sharing. Premiums are paid monthly, which allows you to have coverage. According to the Centers for Medicare and Medicaid Services, commonly called CMS, the average monthly premium in 2023 for a basic standalone Part D plan is $32.09. Some plans are even premium-free, so be sure to shop around before selecting a plan that's right for you. Let's move to the next cost term, which is deductibles. Deductibles are paid throughout the year at 100%. Once you meet the deductible threshold, then your plan would start to share the cost with you. The maximum amount any plan can charge for a deductible in 2023 is $505. The last cost-sharing term, which is co-payments or co-insurance. It's the amount of money that you'll pay concurrently with your plan to cover medication costs. Co-payments are a fixed rate, for example, $10 per medication, while co-insurance is a percentage of the cost. Now that we have the basic terms down for the general costs associated with Medicare's prescription coverage, let's delve into the payment structure. The structure can alter how much you'll pay for medications throughout the year. Medicare Part D is currently structured in coverage phases. I say currently because it is about to be modified with some changes starting next year. There are 4 main coverage phases. As you progress from one phase to the next, you'll pay a different price for medications in each phase. You move to the next phase when you've reached the maximum cost for that phase. The 4 main coverage phases are the deductible, the initial coverage period, the coverage gap, also known as the donut hole, and the catastrophic benefit period. Deductible is the first phase, which starts in January of each year. Let's discuss what percentages of medication costs you'd pay in each phase. During the first phase, which is deductible, you are responsible for paying 100% of your medication costs with a maximum cap set at $505. Some plans don't have a deductible. If this is the case for your plan, you will jump right into the second phase, which is the initial coverage period. During this time, you'll pay 25% of your medication costs, and your plan will pay the remaining 75%, up to a maximum amount of $4,660. The third phase, the coverage gap, is paid by a mix of you, the enrollee, your plan, and also the drug manufacturers. For generic medications, you'll pay 25% and your plan pays 75%. For brand name medications, your plan pays 5% and the manufacturer would discount 70%, up to a maximum of $7,400. During the fourth and last coverage phase, which is the catastrophic benefit period, you'll pay 5% or a copay, and the plan covers the difference. There is no maximum limit in this phase, so you would continue to pay your portion indefinitely throughout the end of the year. However, starting next year in 2024, coinsurance will be eliminated. Part D will pay 100% of the cost of the catastrophic benefit period. Oof, we made it through all 4 phases. Now I just want to share a few other key terms related to a Medicare Part D plan. Plan formulary, drug tier, and basic or enhanced options. Your Medicare Part D plan will have a formulary. This term refers to the plan's list of covered medications, because not all medications are covered. Common medications that aren't covered include things like vitamins, hair growth supplements, weight loss medications, and other drugs. Medications may be added or removed to the formulary at any time during the year. Medicare drug plans must offer at least 2 medications in the most commonly prescribed drug categories and classes. Plans are allowed to select which medications to include in their formulary. You can view a plan's formulary prior to enrolling in the plan. The formulary is organized into tiers. Typically, the lower level tiers cost less than the higher level tiers. Generic medications are usually in the lower level tiers, while brand name medications are in the higher level tiers. Your plan will require you to use lower level tiers, but your doctor can request an exemption to use higher level tier medications if they deem it necessary. What you also need to know is that standalone Part D plans are available as either basic or enhanced options. Basic plans provide the standard coverage, while enhanced plans offer a more comprehensive array of options, such as larger formularies, lower cost sharing, and inclusion of some of the medicines typically excluded from formularies. According to Medicare, approximately 75% of beneficiaries elect enhanced plans. Generally, you'll have the option to enroll in a Medicare Part D plan when you turn 65. Many people elect to enroll in a Part D plan when enrolling in Medicare. However, it's also worthwhile to note that you can delay enrollment in Part D without incurring a late enrollment penalty if you have creditable coverage. This means that you have prescription drug coverage that pays as much or more than Medicare Part D coverage. If you don't enroll when initially eligible and you don't have creditable coverage, you could face late enrollment penalties when enrolling at a later date. When you are ready to enroll in a plan, you can do it in a few ways. Enrolling online by calling 1-800-MEDICARE, filling out a paper application, or contacting the insurance carrier directly. If you'd like to discuss your Medicare Part D options with an unbiased resource, contact your state's State Health Insurance Assistance Program, also known as SHIP. These state counselors offer free expert help in understanding and using Medicare benefits. Thank you for joining me on this overview of Medicare Part D. I recommend you head over to healthnews.com to catch up on some articles, subscribe to our YouTube channel, and ask questions in the comments below. Thank you, and I'll see you next time.